The Head and Neck Cancer Survivorship Clinic is a joint initiative between UPMC's Department of Otolaryngology and the University of Pittsburgh School of Nursing. Many of our head and neck cancer patients undergo multiple treatment types, including radiation, chemotherapy, and surgery. While these treatments can cure patients of their disease, many are left with side effects that can impact their quality of life and impair their ability to complete their daily activities. Our Survivorship Clinic takes a multidisciplinary approach to addressing patients' individual needs. Our team consists of a head and neck surgeon, nurse, speech-language pathologist, physical therapist, dentist, and audiologist, who have specialized training in head and neck cancer patients and their needs. In the Survivorship Clinic, we take a patient-centered approach to care in order to help our patients live beyond their cancer. We believe that a team-based approach will allow us to create coordinated care plans that address the needs that patients find most important to them.
Mr. Kuhn completed his treatment about a year and a half ago, and he came to us with several problems. One was dry mouth, difficulty swallowing, he was stiff. He also had some dental questions that were causing some difficulty with his swallowing. We have a team approach that addressed all of these questions. And then from that point, Mr. Kuhn went through several different therapy sessions to help improve.
When Dell first came through his chemotherapy and radiation, we frankly had some unrealistic expectations. We were really surprised by the significant damage that was done to both his throat and his overall physical health. He was, of course, very fatigued and tired. He had scarring in the throat. It was sore to even swallow. His mouth was dry. At one point, we asked his primary throat doctor what we should do, and there was kind of a sense of, well, just wait and see. And probably you can tell a little bit from Dell's discussion, we're not wait and see kind of people.
While I'm a patient, I have no patience. And I didn't want to wait around in waiting rooms to talk to the therapist, to talk to a dentist, to talk to the doctor. That was all coordinated, all extremely well orchestrated. And I saw one after the other, and they could actually get together among themselves and discuss my particular situation.
When he had the Survivor Clinic, we immediately responded positively to his participation in that. It was like you put a big umbrella over his condition. Instead of looking at these slices, you looked overall and you said holistically, how can we achieve a better quality of life?
One of the things that most impressed me was the fact of the interrelationship and the cooperation between the different disciplines. Tammy came out to see one of my throat therapy sessions. I know that the dentist talked to Dr. Johnson. Just everything seemed to dovetail together and made a one cohesive path forward.
The Survivor Clinic has been a model for us that's really quickly put it all together. Had we been able to do that even 3 or 6 months earlier, I'm sure we'd be significantly further along now. The fact that you can do more things for yourself has a huge impact on your overall attitude. And then the fact that you feel better, you can taste some things, you have more confidence in the way you can move. We're able to get out and have pieces of our life back. And that's what this was really all about.
And while I realize that I'll probably never be as mobile or as active as I once was, I don't accept it. I'm basically a fighter, a survivor, and they've shown me a way, and my determination is to prove them wrong.